Welcome back to The Forgotten Trimester, a channel dedicated to the education of women on all things postpartum. On this episode, we're going to focus on the C-section scar. You'll learn about the healing process of the skin of the C-section scar. You'll learn how to care for your scar appropriately. You'll learn the changes that occur around the C-section scar that are normal, and then what to look for abnormal. Thank you for joining me today. My name is Dr. Megan Gray. I'm a board-certified OBGYN and mother of 2 littles. I myself have had 2 C-sections, so all you ladies out there that have had C-sections that are tuning into this show, I hear you. It's tough. C-section recovery is no joke. It is major abdominal surgery. It's the most commonly performed surgery in the United States, but that doesn't mean that the recovery is easy. Let's start with the healing of the C-section scar. So the skin itself usually will be healed over within about 7 to 14 days. So you'll notice that initially there's a kind of a tiny little gap of the skin, whether it was closed with staples or with stitches underneath the skin. However, over the course of 7 to 14 days, you'll notice that skin starts to close until it's completely closed and all you see is a line. The tissue underneath the actual skin incision takes a little bit longer to recover. So that's going to be about 6 to 8 weeks to fully heal. So one of the most common questions I get asked about a C-section scar is, how do I keep it clean? Can I wash it? Yes, please take a shower. We encourage showers. So definitely when you get in the shower, allow the water to hit the incision and just fall down. If you'd like to use soap, I would take a mild soap like Dove or Ivory or Dial unscented soap and put it on the tips of your fingers and just use the tips of your fingers to rub above and below the incision itself, not over the incision itself, but just above, just below. Then let the water hit it and fall down. We use the tips of our fingers to avoid scrubbing. Please don't use washcloths or loofahs. Yuck, they're dirty, and it allows you to apply a little bit more pressure than you would with just the tips of your fingers. Another important part of C-section scar management is keeping that scar as dry as possible as it's healing. Because of where it's located, a lot of times women will sweat or they have some extra skin that folds over the actual incision, and it allows for moisture to collect down there, which then will allow for bacteria and yeast to grow. So in order to avoid that, make sure that after you get out of the shower, anytime you clean, that you fully dry that area. So that means either taking the hairdryer on the cold setting and drying really well, or taking a towel and patting dry. Try not to rub. You don't want to disrupt staples if you have them, and you certainly don't want to irritate that tissue as it's trying to heal. If you happen to have a pannus, so that's the extra skin that folds over the incision, be sure that in between washing that incision is staying dry. And 2 ways you can do that. You can either get some gauze, some sterile gauze from a medical supply store, or even like Walgreens or Walmart. Any pharmacy usually stocks that kind of stuff. And you can roll it up and place it against the incision, allow your skin to fold back over the incision, and get some underwear and put over that so that it holds it in place. If you don't want to get sterile gauze, you can get a maxi pad, and just make sure it's unscented so it doesn't irritate the skin, and place it up against the skin. Same thing, allow the skin to fold back over it, or just take the underwear and pull up over it to hold it in place. That will wick the moisture away from the incision throughout the day. Now, be mindful, if that's what you're going to do, that you are changing either the gauze or the maxi pad frequently throughout the day, especially if it's in the heat of the summer. You don't want that wet gauze or maxi pad to sit up against the skin. That causes even more problems, because then you've got something that's just a nidus for bacteria and for yeast. So change frequently throughout the day so that it does not stay wet. A lot of women want to know, well, what about these scar creams, the anti-scar creams, moisturizers? When can I use those? So if you want to use that stuff, I usually say the skin has to be completely closed before using that. So I usually say about 3 weeks to give you some buffer time before you start using that. So anywhere beyond 14 to 21 days, you can start using those creams. You can put it gently on the incision and actually massage it into the incision to kind of break up the tissue that's underneath the actual skin incision. But please do not apply any of that until the skin is fully healed. Like I said, that'll be at least 14 days after the C-section. So recap how to care for your incision. Keep it clean, just water or a mild soap. Do not scrub the incision itself. 2, keep it as dry as possible. And 3, avoid moisturizers and anti-scar creams for at least 2 to 3 weeks after your C-section. So let's talk about normal changes that occur with the skin around the C-section scar. So you may notice some skin discoloration around the actual C-section scar itself. You might notice some redness, which is normal. So a mild redness right along the actual incision of the skin can be normal. If you have staples, you may also notice some redness around each staple. That's okay, that can be normal as well. It's just a little inflammatory response to the staples. It will resolve. It should get lighter and lighter every day. You may notice also some bruising of the skin around the skin incision itself. That can be normal. Some people are very sensitive to the stretching and pulling of the skin. It can break some small blood vessels underneath the skin. That will go away over time. It should not get worse. So it should be at its worst within 24 to 48 hours after the actual C-section, and then slowly get better. You may also notice some drainage from the incision. That can be completely normal. A small amount of drainage within the first 24 to 72 hours after the C-section can be absolutely normal. Usually that drainage is going to be a light pink in color. Sometimes it might be a deep, deep red. That drainage should go away usually within the first 72 hours after the C-section. A lot of women are always alarmed with numbness around the incision, and that is completely normal. So when we make the skin incision, we cut through microscopic nerves that supply the skin. There's no way around it. It happens. So that's why the incision, the skin right above it and right below it might be numb. It may be numb for the rest of your life. So a majority of women will have recovery of sensation around that area. Usually it might take up to a year to a year and a half for full recovery. Some women though will always be numb there. If you're a person that shaves in that area, because usually these incisions are really low, right just above the pubic bone, just be mindful as you're shaving to watch, especially for the first 6 months to a year, so that you're not nicking that area and not realizing it, not feeling it. Some women will also experience some itching of the skin around the incision, especially as it starts to heal. That can be completely normal. Just make sure you don't notice any rash around the skin, but if it looks normal to you, itching can be very, very normal as the skin starts to heal. So let's talk about abnormal. So when do you start to worry that something might be going on, or it's not healing correctly? You may have an infection. So remember we talked about just a minute ago, drainage of the incision. Some drainage of the incision is completely normal if it's light pink or very dark red and it's a small amount and it resolves within 72 hours. Heavy drainage, whether it's light pink, dark red, bright red, is not normal. That should be evaluated. So if you're noticing a heavy amount of drainage, so it's soaking through a pad, so you're having to put a pad against your skin to wick away that drainage, and it's soaking through it every 1 to 2 hours, that is not normal. You need to alert your physician so that they can evaluate that. If you're noticing that the drainage is not a light pink, but more of a bright red, or it's green, yellow, foul smelling, none of that is normal. That needs to be evaluated immediately. So bright red bleeding or green, yellow, foul smelling needs to be evaluated, whether you're having just a little bit or a lot of drainage. That needs to be evaluated. Please alert your physician. Now, as we previously discussed, some discoloration of the skin around the incision is normal. However, if you're noticing the skin discoloration is getting worse instead of better, so if you have some redness around the actual skin incision itself, and you're noticing that it's expanding, that it's growing either above your incision more or below your incision more, that should be evaluated. That might be a sign of a skin infection. If you're noticing other colors other than pink or red, so like a dark purple or almost black color of the skin around the incision, that's not normal either. That needs to be evaluated. So if you're noticing that color, please alert your physician immediately so that they can take a look at it and make sure that there's nothing more serious going on. So obviously you're going to have some pain along the incision. That's normal. The pain should improve over time. If you're noticing that the pain is worsening over time instead of improving, or you're having redness along with significant pain, redness of the skin itself along the incision and worsening pain, or a drainage, green, yellow, foul smelling and worsening pain, that needs to be evaluated. That's not normal. Another thing to look out for, if you start noticing that swelling underneath the skin, so you start to get a big old lump underneath the skin on one side of the incision or the other, and it's not uniform, that could be a sign of something called a hematoma, which is a collection of blood underneath the skin. We want to make sure that that's not getting worse. So that should be evaluated so the doctor has an idea of what size it is, and so they can monitor for growth and also to make sure that it doesn't become infected. One last thing to look out for with the C-section incision, if you start having a fever. So a fever after a C-section is considered 100.4 degrees Fahrenheit or greater, and you're noticing any of these symptoms or just a fever itself, that needs to be evaluated. So please notify your physician immediately. So a quick recap of my do's and don'ts and abnormal versus normal really quickly. Do shower and keep the incision as clean as possible. Do keep the incision as dry as possible. And do avoid anti-scar creams or moisturizers for at least 2 to 3 weeks after your C-section. My don'ts after a C-section: don't submerge the incision in a body of water. So completely sitting in a bathtub, hot tub, swimming pool, lake water, beach water for at least 6 weeks. Allow that skin to completely heal before you do that. Don't use anti-scar creams or moisturizers for at least 2 to 3 weeks after the C-section. And don't ignore any problems that you notice around the C-section scar. If you have any problems at all, please contact your physician. Quick recap of normal changes after a C-section: some skin discoloration around the actual incision itself, numbness of the skin around the incision, some minimal drainage of the incision, and some discomfort of the incision itself. Abnormal changes associated with a C-section scar: worsening skin discoloration, worsening pain of the incision, new lumps or swellings underneath the skin of the incision, fever 100.4 or greater, significant drainage of the incision or bright red drainage of the incision, or green, yellow, foul smelling drainage of the incision. All those abnormal need to be evaluated. Contact your physician. So that does it for C-section scar management. Certainly, if this brought up any questions, please ask your physician. If you have any broad questions, ask them below. I wish you the best of luck with your C-section recovery. I look forward to seeing you here real soon on a next episode. Bye-bye.